Medical Council restrict doctors from using social media misuse. Hello friends, my name is Dr. Nitin and if you are new to this channel, please subscribe to this channel. I help doctors and clinical practitioners to grow their clinical practice with ethical marketing practices. So, if you have come across this news and if you are a doctor or medical practitioner, today's video is useful for you. So I'm going to talk about uh, the social media uses or guidelines given by the Medical Commission for the doctors regarding the social media uses. So I'm going to interpret the guidelines that are provided today, and we'll talk about it and what doctors should be doing or what should not be doing on social media, that we will talk about in today's session. So the National Medical Commission, that is NMC, they have recently implemented some stringent guidelines to regulate doctors' use of social media. This is aimed to uphold ethical standards within the medical and clinical practice. So this initiative arises from the increasing concern about the misuse of social media for self-promotion and patient testimonials, which basically compromise the integrity of the medical practice. So first of all, I welcome this initiative and the guidelines also given by the NMC, and I do support this. So let's understand in detail what does this means for the doctors, what doctors should be doing and what they should not be doing. So before I start, I will read out the exact quote that appeared in the news media. Okay, and I quote, patient testimonial videos which are considered unethical and are even now banned, with violations categorized as a serious offense. They have become extremely common among the doctors today. Quote, it is observed by senior doctors from IMA and MMC. On top of this, Dr. Rajan Sancheti, who is the president of Indian Medical Association, that is IMA Pune, he said that, I quote, it has become extremely common now. We are witnessing an explosion of patient testimonial videos on social media these days. Doctors are increasingly showcasing patients speaking about their treatment as a marketing tool, where they are also present in the video. This is shocking. This practice is not only unethical but also blatant trick to attract more patients. Unquote. So let me summarize some of the key points from the news and from the guidelines. So let's understand this. What are unethical practices identified? So the NMC has noted a rise of doctors using patient testimonial videos and manipulating social media metrics. Example like buying followers as a marketing tools. So such practices are deemed unethical and can lead to severe penalties to doctors, including suspensions ranging from 3 months to up to 3 years. So what does this new guidelines talk about? The NMC's guideline explicitly prohibits sharing of patient testimonials or videos showcasing treatments. Okay, so treatments we cannot show. Discussing patients' treatment or sharing images of the patients on social media, and buying of likes, followers, or engaging in any form of self promotion through social media. It prohibits posting of any content that could compromise patient confidentiality or trust. It also, so let's understand what are the consequences for the violations. So if any doctor is found in violation of these guidelines, they may face some disciplinary actions which can reinforcing the importance of maintaining a professional and ethical conduct in all forms of communication. So, what are the guidelines for the doctors? So, let's understand with the avoid any patient testimonials. Do not post videos or contents featuring the patients discussing their treatment and experiences. Maintain patient confidentiality. We should refrain from sharing any patient related information, including any images or treatment details on social media platforms, so that we can avoid. No self promotion. So do not engage in practices aimed at artificially inflating your online presence, such as purchasing any likes or followers. Many people do that, so we should avoid that. But this is more critical. You can educate responsibly. While sharing medical knowledge is encouraged, you can share medical knowledge. You need to ensure that information is accurate, verified, and within your professional expertise. This is very critical. Then you need to also understand how to do professional conduct. Always conduct yourself with dignity on social media. Avoid discussions that could undermine the trust in the medical or healthcare profession. You can seek guidance if uncertain about specific post or practices. You can consult with your peers or refer to the NMC guidelines in detail to ensure the compliance. You can also report any kind of misconduct. You can become vigilant about any unethical practices within the medical community and report them as necessary to uphold the medical and healthcare standards. You can stay informed, regularly update yourself on any changes uh, regarding the regulations and guidelines. Those are issued by the NMC to remain compliant with the NMC social media guidelines. So, by adhering to these guidelines, doctors can contribute to a more ethical and trustworthy medical environment while effectively utilizing social media for their educational purposes without compromising their professional integrity. So, based on these recent guidelines, those are issued by the NMC, National Medical Council, doctors can continue to use social media. They can use social media for education purpose, but they must adhere to the strict regulations to ensure that ethical conduct and they can maintain the patient trust. So, doctors can utilize social media as a tool for education and communication. We can use it, but they must do it responsibly and ethically. The NMC's guideline is aiming to protect the patient rights and uphold at the same time uphold the integrity of the medical profession in this digital age. Non-compliance with these regulations can lead to severe consequences, including the suspension from the practice. So, I hope you are clear with these guidelines and what should be done and what should not be done, what things should we avoid while using social media for our clinical practice. So, if you still have any questions or any doubts, or if you feel that if I missed something in these guidelines, you can please let me know in the comment section. You can share into comment section, and please do share this video with other doctors, your medical community, your friends, your colleagues, or your employees. You can share with them so that they can also get aware about the use of social media, what they should be doing and what should they should not be doing with reference to your clinical practice. And please do share with others, and please let me know if you have any questions. I would be happy to share more details about these guidelines or any particular aspect or anything particularly that you want to know more in more detail. I can share that. So that's all for now. This is Dr. Nitin signing out. Bye bye.